Welcome back to Studio 4. You've likely noticed an ad for testosterone therapy somewhere in the recent months, and the promise is more energy, better workouts, even a better mood. Dr. Brian Weiss, the Regional Dean of Texas Tech University Health Sciences Center School of Medicine, joins us today to talk about what we need to know. And Dr. Weiss, thanks for coming in.
Oh, thank you.
It feels like testosterone therapy has become really popular. Why are men so interested in it?
Well, just to remind everyone, testosterone is the dominant hormone in men. That's what makes us men, basically. So, the question is more better? Right? Does it make you more manly in that sense? And so there's, most men, testosterone, there's a big range from about 200 to 1,200 nanograms per deciliter.
Okay.
And at different ages in men's life, they should be at different points in that spectrum. Now, what we know is that if a man has 2 morning testosterone levels checked that are below 200, that's a man that probably would benefit from having supplements of testosterone.
Gotcha.
All right. And what we do know is that testosterone increases sex drive, what we call libido. It can improve sexual function. Okay, it can actually help depression. It can help energy in men who need it. Okay. Now the question is how many of all the men who are now on testosterone, what percentage of men probably qualify for it based on those standards? Maybe only about 12%. So that means probably about 88% of men out there are on it, okay, and may not really benefit from it.
Okay, wow. And if so, low testosterone is common.
Not common, but it occurs.
Can be.
Absolutely, yes. Yeah.
Wow.
But what we do know is testosterone is like any drug. Okay? It has good effects, also has some bad effects. Right? And so what we look for in terms of bad effects from testosterone is we do know that it raises the red cell count, what we call the hemoglobin.
Okay, yes.
And that can get dangerously high in some men who are on testosterone. In fact, we actually have to bleed men sometimes to try to lower that blood count.
Wow.
So that's one side effect. Okay? We also know that basically there's a slight chance it increases clotting. So like clots in the legs or clots that go to the lung.
Oh, that's not good.
That's not good either. There was some worry that maybe it might increase cardiovascular risk, like heart attacks. That has not been shown to be true yet. Okay, so we're holding off on that one. And then for the most part, it actually, believe it or not, it reduces fertility. So it may make a man maybe want to have intercourse more, but it actually reduces sperm count. And so in men who are trying to start a family, it may be working against them, actually. So it does have some deleterious or bad side effects.
Oh, wow. I had no idea. And Dr. Weiss, there are a lot of online clinics and advertisements that, make getting testosterone seem very easy. What should the consumers know about that?
Well, so it's not the fountain of youth. I think that's how it's oftentimes portrayed. Like, oh my gosh, get on testosterone, you're going to live forever and be a big virile man.
Right.
Not true. All right. And so what we should know is that there are men who need it, and that if there's concerns, go to your doctor. Your doctor can do this test where we test the blood level of testosterone. We do 2 morning tests. And if those come back below 200, absolutely, it's indicated for a man. And then we try to bring it up into the middle of that 200 to 1,200 range. We try to shoot for about 500 to 600 is where we want it if a man has taken testosterone. You can't take it by mouth. Okay, so it has to be by shots. It has to be by basically creams or gels. It soaks in. If you take it by mouth, the GI tract basically destroys it.
Oh, I see.
Yeah, so it has to be delivered through shots or creams or things like that.
I really didn't have much of an idea of what testosterone therapy was, but I learned so much just now. Dr. Weiss, thanks for coming in today.
Yeah, sure, absolutely. Thank you for having me.
Of course. Stay with us. We have more Studio 4 coming up after the break.